Hi, this is Stephen Neufeld, an orthopedic foot and ankle surgeon from the Orthopedic Foot and Ankle Center.
And I'm Daniel Cuttica, an orthopedic foot and ankle surgeon from the Orthopedic Foot and Ankle Center, which is part of the Centers for Advanced Orthopedics.
Today we're going to be talking about the correction of bunion deformities. And we'll talk about a Lapidus, or talk about minimally invasive bunion surgery, or a MICA.
So a bunion in general is an alignment problem with the bones in your foot and the big toe. So when we look, the first metatarsal bone, which connects to the great toe, is malaligned. So typically you can see how these other metatarsal bones are nice and parallel. With the bunion, this first metatarsal bone is rotated inwards. And when it is rotated this way, their big toe tends to go the other way. So it's a prominent bone related to the alignment of that bone. It can often become painful because of improper shoe wear or lead to pain and discomfort.
You know, it's interesting, Dan. A lot of patients come in and they think that they have a growth that is growing outside their foot, and we have to just remove the bunion. And we know that it's really not removing a bunion. It's actually, as you mentioned, a malalignment problem. So it's actually correcting the deformity and not shaving off any bone typically.
I think that's a great point. Historically, we used to just shave off the bump, but what we've known from past mistakes is that led to an almost 100% recurrence rate of bunions. So you have to correct the alignment in order to properly treat a bunion.
Correct. In the last, I'd say 5 to 10 years at least, I think our approach to bunions or a malaligned crooked metatarsal has really changed. And I think historically we thought it was a growth, we would just shave it off, and then the patient would do well. And we've learned that they don't do very well at all. We now look at the deformity as not only moving it in one malalignment, but sometimes there's also rotational deformity. And some people refer to it as a 3D correction or a 3D malalignment, where the toe is rotated as well as moving in a abnormal position. So the approach now is either realigning the bone through a cut in the bone or realigning the bone through a fusion. I first want to address what a Lapidus or a lapidoplasty is. And a lapidoplasty is just a name that some company came up with to describe a Lapidus. And a Lapidus is taking the first metatarsal, pushing it back into position, and holding it there with a fusion. And a fusion means you're taking two bones and gluing them together with screws or a plate or staples, something that makes the foot stiff so that that metatarsal can't move back to its malaligned position, and theoretically holding it there so the bunion stays away permanently. And that's called a Lapidus, or some people call it a lapidoplasty, but that's specific for one particular company.
Another way to correct a bunion is through a minimally invasive approach, and that's actually been around for quite some time, developed in Europe over 15 or 20 years ago, and we've recently been starting to do it here in the US over the past probably 5 to 10 years. The key principles with that are we're using tiny keyhole incisions, so about 2 millimeters, and you're correcting the alignment of the bone through those small incisions, and we have special instruments that allow us to do that. A minimally invasive approach allows us to correct the alignment of the metatarsal bone through these small, tiny incisions. The other important difference between that and a Lapidus procedure is that you are realigning the bone through the metatarsal. So you're actually realigning and breaking the bone and realigning it. So we're not sacrificing motion as you do with the fusion type of procedure.
That's a great point, Dan. You know, people think that a Lapidus or a benign procedure, oh, we just put a couple plates and screws and we fuse it. But the reality is that when you do a fusion, you're actually sacrificing motion. So you're making the foot stiffer. And not only that, if that fusion isn't put in the exact proper location, which is sometimes very difficult, that patient will have problems that will be very difficult to correct. There's very little forgiveness when you fuse a joint. There's no going back. It's one and done, and then you're stuck the rest of your life with a destroyed, fused joint.
Exactly, and I think, and which we'll talk about it a little bit, there are some key differences as well.
The risk of a Lapidus is that the fusion may not work. There's a lot of risks involved in when you're taking two bones that are crooked and fusing them together. You're trying to create one bone from two bones. And there's a relatively high incidence of complications like fusions that don't take, or a long-standing pain. It's a much bigger operation with a much longer recovery, a lot more pain, and a lot more chance of that fusion not being perfect. Because that you're relying on these two bones to glue together or fuse, the recovery is much longer than minimally invasive surgery. It takes at least 6 to 8 weeks, sometimes 3 months, for two bones to fuse together. So therefore, during that time, you need to protect them. Most people have to remain non-weight bearing for a long period of time. There's a lot more swelling, a lot more pain, and I would say it could take almost a year before somebody fully recovers. Plus, the screws and the plates that are used to fuse those two joints together sometimes are very prominent, and they need to come out because they're painful later on.
Yeah, and I think the key you mentioned there that I don't think we talk about enough is that there is a fair amount of swelling immediately post-operatively, but also it persists even as the bone heals, or when it's healed, there's still some residual swelling that lingers for several months, because it is a more invasive procedure, and it is a fusion type of procedure. And I think that's one thing that's important to stress.
Yeah, Dan, we're not really seeing those complications with minimally invasive bunion surgery. What are we seeing in our practice?
No, I think it's pretty impressive. I think the amount of swelling that you have with the minimally invasive surgery is significantly less, and I think that's kind of what a big reason why that we've all kind of gone in that direction. I think we notice a lot less swelling, and I think we notice a lot less pain. Patients usually only need about 2 days worth of pain medicine. I think the other important thing is, because of the smaller incisions, again, you're talking 2 millimeters, we have a lot lower risk of wound complications and infection problems. And then another key thing is that the big toe does not get nearly as stiff, because there's a lot less soft tissue dissection with that type of procedure. So it's actually pretty impressive, and it's fairly dramatic in my eyes, and I'm sure you've the same experience.
I've seen the same thing. In fact, we've published a paper, so people can refer back to our paper in the journals that show a very low incidence of complications, a very small instance of hardware needed to be removed. And we've published that in a journal, and it's out in the public. It just proves the point that you just made.
Mm-hmm. One thing to note, any bunion procedure, it is important to know that there is always that long-term risk of bunion recurrence. Now, I think with the minimally invasive procedures, if you look at the literature, it's around about a 5% risk, and I think that is a little bit better than some of the traditional bunion surgeries. It's about similar to up to 10% with the Lapidus type procedure as well.
I think it's important to distinguish what patients need a Lapidus, and when I say need a Lapidus, I mean need a Lapidus. A lot of surgeons out there will say, oh, we'll just fuse your joint, we'll do a Lapidus. But the reality is, certain people need a Lapidus or a fusion, but most people in our situation or in our experience do very well, if not better, with a minimally invasive bunion surgery. So the indications for a Lapidus or a fusion are really patients who have who have arthritis or have instability. So their joint is not a healthy joint, it's a loose joint, they have arthritis, and they need to be corrected through a fusion. If they don't have those indications, then I think minimally invasive surgery is a much better approach.
And those are my 2 indications as well. I think even a fairly severe bunion actually can very well be treated with a less invasive, minimally invasive approach. There are instances, unfortunately, not 100% of people can undergo or are candidates for a minimally invasive procedure, and those are the ones where we do need to consider Lapidus. But that probably is only about, I think in our practice, probably about 10% of patients.
Even less. Yeah. I hope this short discussion helped explain some of the differences between a Lapidus or minimally invasive bunion approach. They are very different operations. They do treat the same thing in terms of a deformity, but they're for very different reasons and have very different outcomes with very different risks.
Thank you for listening. Please don't ever hesitate to get in touch with us if you have any questions.